You've just found out that you or a loved one needs open heart surgery. Well, be assured you're in good hands. The doctors at Sentara hospitals have been performing open heart surgery for nearly 40 years. Sentara's multidisciplinary team brings expertise gained by volume and knowledge through working together for decades.
Rest assured in knowing that you'll be cared for by a long-standing synchronized team, including heart surgeons, cardiologists, and cardiac anesthesiologists who work exclusively with heart patients. Additionally, highly trained perfusionists, physician assistants, nurses, nurse practitioners, cardiac technologists, dietitians, therapists, rehabilitation specialists, and patient educators will all play a part in your care. Sentara features centers for cardiac surgeries with excellent success rates. The two most common heart surgeries are coronary artery bypass graft surgery and heart valve surgery. First, bypass surgery is needed when the coronary arteries that feed the heart have a blockage that interferes with blood and oxygen that's being delivered to the heart. The purpose of bypass grafting is to get the blood and oxygen around the blockage into the heart. The second type of heart surgery is valve surgery. The heart's valve works to control the direction the blood flows through the heart. When the valve can't open or close properly, surgery may help. Today, some patients may be a candidate for minimally invasive repair or replacement valve surgery, which is offered here at Sentara.
In minimally invasive surgery, specifically for the aortic valve or the mitral valve, we can offer the patient a procedure that is a much smaller incision. The process is based on newer technology to allow us to go on the bypass pump without splitting the sternum and to replace or repair the valves in the heart.
The length of time people are staying in the hospital has been decreasing over the past several years. When you come in, we want you to know what to expect. However, please know that each patient is unique and different, and that your treatment and recovery may differ from another based on your individual need. We tailor the care to each individual. We're going to give you a patient pathway. It describes what typically happens each day of your heart surgery program. Your nurses will help you and your family understand the patient pathway, which will help you guide your activities. Here are some of the things as a patient you need to know and can expect for your surgery. Preparations will include shaving parts of your body, making sure all tests are complete, and knowing what you need to do before surgery. For example, you'll be asked not to eat or drink after midnight before your surgery. Remember, you'll be moved to another location after surgery, so it's a good idea to send personal belongings home with a family member or close friend. A cardiac anesthesiologist will meet with you sometime before your surgery. In the morning on the day of the surgery, the nurse will give you your pre-op medicine to help you relax. From then on, you'll need to stay in bed. A nurse will confirm information on allergies and when was the last time you've eaten. Family members can stay with you right up until you enter the operating area. Please keep in mind that in a hospital, emergency situations may occur that could impact your schedule. We'll keep you informed if delays occur. While you're in the cardiac surgery intensive care unit, the only things you'll need are the hospital's wash basin and your breathing exerciser. If you wear glasses or dentures, your family members can bring them to you when you're fully awake after surgery. When you go to surgery, your family can wait in the Cardiac Surgery Family Lounge. Most open heart procedures last from 3 to 4 hours, although sometimes it may take longer, up to 8 hours. Family members are encouraged to take breaks during this time, but let the staff know before leaving the waiting area. When the surgery is nearly complete, an operating nurse will call the family to give them a brief report on your condition. After the surgery is complete, the cardiac surgeon will talk to your family and answer any questions. It's frequently 45 minutes or so after the surgeon talks to your family before they can see you. After the surgery, you'll be moved to the Cardiac Surgery Intensive Care Unit that specializes in the care of heart surgery patients. A nurse will tell your family when they can see you. On the first visit after surgery, the immediate family can come in as a group. Visitation is centered around the needs of the patient. Later, visitors are limited to 2 at a time and at specified times. We ask all family members to follow the visiting policies which have been set with the patient's needs in mind. During the first visit, your family should expect to see you asleep, cold, pale, and swollen. This is normal after open heart surgery. Also, your family should expect to see many tubes attached to your body. Your nurse will explain what these tubes are, and there is more information about this in the patient pathway. You may also be receiving your own blood back after surgery from the heart-lung machine, and again, this is a routine procedure. You and your family can expect the care team to use sophisticated medical equipment during your recovery. The ventilator, for example, helps you breathe. You'll not be able to speak while a ventilator is in use, but a nurse usually takes it out on the same day or the morning after the surgery. Intravenous tubes supply medication and provide special measurements. And a heart monitor allows nurses to closely watch your heart rate and rhythm. During your stay in intensive care, you'll be seen by the cardiac surgeon and a physician's assistant. One family member should serve as your family contact person. This person can call the unit anytime, day or night, for a condition report. To help control the number of calls to the intensive care unit, the contact person should share the information with the patient's family and friends. Other callers should realize that the hospital's patient information operators routinely list all intensive care patients in critical condition. In most cases, you will be in the intensive care unit overnight and then moved here to the cardiac floor the next day. While on this cardiac floor, you will be seen by nurses and nurse practitioners. The staff will notify your family of that transfer and give them your new room number. Even after the move, you'll have tubes attached to your body, like the chest tube and the IV, and we will continue to monitor your heart rate and rhythm. When you transfer to the cardiac floor, you'll begin to play a more active role in your recovery. You can use the patient pathway to track your recovery. You'll be out of bed and active the first day after surgery. Nurses will encourage you to sit up and breathe deeply and eat. They will help and encourage you to use the breathing exerciser and the cough pillow to ease any discomfort. You'll be walking the hallways the first day after surgery. Deep breathing, walking, and resting are important things to do to help your recovery. Some discomfort can be expected after surgery, but we have found that some people who are hurting don't breathe as deeply or move as much as they should. Talk to your nurse if you are hurting so we can get you the appropriate pain medication. Depending upon your surgery and your recovery, you may have chest tubes or pacing wires. If so, they will be removed when appropriate. However, this will vary for every individual. If there is no drainage from your incision, they will be left uncovered after that. We will work with you so that by the time you go home, you'll be comfortable taking care of your own incisions.
We follow our quality indicators here at Sentara very closely, and we have bettered the national averages consistently.